Hello dear friends, today I am going to teach you about how to read surgery for your prof exams as well as for your next exams. And also I am going to discuss about which book to prefer for your surgery subject. I have already explained medicine subject idea, step-by-step approach and complete understanding which book to prefer for medicine, and video link given in my description box, and you can also check out video link in my I button. This video is divided into two parts. First video I am going to discuss best book for surgery in theory as well as practical, and second video is going to tell you about how to read surgery step-by-step approach for your prof exams till your next exam. So let's start our first video, which is book recommendation and best book for surgery for theory as well as practical. In the market, multiple options available for theory books, but choose the book which is suitable, convenient and comfortable to you, because end of the year you have to recall and reproduce in your prof exams from that particular one book only. If you are choosing high level book, end of the year you are not going to recall any of the particular concept or subject idea for your prof exam. So remembering that point, I am going to tell you there are some of the important options for surgery subject: Bailey & Lowe, SRB, Manipal, Sabitson and Swartz. Bailey & Lowe, as you are all knowing, is a classical gold standard book for your prof exams as well as considering in terms of next ini-cet, AIMS and all exam. Word to word, line to line questions are coming from that Bailey & Lowe book only. But you can also prefer SRB, Manipal, Indian author books, which is also quite good book, same to the level of Bailey & Lowe, same concept, same idea for these books, which is consist of Indian authors. You can use for your reference Sabitson and Swartz. Don't follow this book as a primary source, because this book is high level book, not to your level, and also PG preparation and specialty book. If you are not going to understand any of the topic from this book, you can take a reference of this Sabitson and Swartz just for reference purpose only, because high level book is not helping you to recall and concept based understanding for your surgery subject. Yes, so that's why I am going to recommend you can choose Bailey & Lowe, and if you want some easy language or some easy topic book, you can choose SRB or Manipal. There is no worry about it. All the books are same concept, same surgery idea, same knowledge, but foreign publisher, Indian publisher, slight bit hard and slight bit tough language. But SRB and Manipal is easy language book. You can prefer any of the three, and for reference, as I mentioned, Sabitson and Swartz, you can follow just for reference. For the practical, also multiple options available in the market, but most of the Indian students are preferring AS for their practical purpose. AS is a quite good book for your clinical examinations understanding. Makhanlal Shah is one of the another options for your practical, and for your surgery subjects you have to follow some two books like long cases and short surgery cases from Bhattacharya, which is going to help you in your university practical examination. So you can follow this long cases and short surgery, some important and high yielding cases like ulcer, swelling, trauma like cases you can follow from Bhattacharya. Thyroid breast cases from you can follow practical purpose from long cases, and as thus is a quite good and gold standard, you can say gold standard and commonly used by students and faculty. Okay, and I am also recommending you can also watch out and look at the audio library of Ghanshyam Vaidya, where they are explaining the how to take history, how to take clinical examination, and how to make differential diagnosis list for your practical exams. So you can also refer audio library by Ghanshyam Vaidya, which is available in YouTube easily, so you can check out practical source with audio library also. Some of the important points about surgery subject: don't start surgery with high yielding topic like GIT, urology, tough topic. Start the surgery with basics understanding, basic suture technique, anastomosis, fluid replacement therapy, or burns, trauma. That's some of the easy topic you can start with basic surgical skills. Okay, so with that surgery easy topic, you are going to understand the surgery in simple, smart, conceptual way, because surgery is not a subject which you are going to mug up like medicine. Yeah, surgery is going to subject you have to passionate about the surgical branch, so you can take conceptual approach for surgery subject. Start with easy topic, make class note, and follow any of the faculty from any of the platform. I am not going to tell you whichever faculty you are following, that all faculty are same, all faculty are giving you perfect idea about surgery subjects from William to Sabiston and Schwartz, complete understanding about concept, complete understanding from that particular book. Whichever faculty you are following, all the faculty are same and they are explaining all best in their level. So start with easy topic, make class note, follow any of the faculty, and end of the day solve question bank, which is totally clinically oriented question bank, because surgery is the subject, is the storytelling. Follow the story, you can understand the complete concept of the surgery, like theory, clinical aspect, clinical examination, and surgical part in your OT area. This is going to be a storytelling like thing. So you don't have to mug up anything, you have to build your concept and make your base strong for surgery. That's why surgery is going to be a clinical knowledge, theory knowledge, and practical knowledge. All three combinations make this surgery easy and concise and small, good, understandable, conceptual subject for your prof exams to for your next exam. And you have to passionate about surgical branch, so you can get fun out of it and you can understand the subject easily like anything. So clinical knowledge you are getting from Estes, theory knowledge you are getting from Bailey and Love, and for practical knowledge you are getting some of the videos of surgical understanding from YouTube. Also for the surgery subject you are following clinical videos, like clinical examination video you should know and you should watch from YouTube or any of source if you have access of the thing. Procedure video, instrument, like they are performing biopsy, Ryle's tube insertion, or any of the small surgical procedure, what procedure that you should be knowing from procedure videos. You can watch video from YouTube or any of other sources. Surgery videos, like you can watch trauma, how to handle patient in trauma, swelling, how to aspirate, aspiration, incision, swelling, ulcer videos, burns, urology, GIT surgery. You can, some of the videos you can also preferring to watch from YouTube. An important topic list, as I also mentioned in my practical point, hernia, ulcer, swelling and trauma. It is going to be a high yield for your practical point, and faculty is fond of asking generally to all students about this hernia, ulcer, swelling and trauma. These four topics make your practical easy and understandable for your prof exam. And for other important topics, considering in mind that you are preparing for your next exam, so breast is important, thyroid, urology, GIT, fluid replacement and burns. This is the sum of the important topics. You are preparing for your any of the standard books, whichever you want to prepare from any of book you can choose, but also I am going to tell you, choose book that is convenient and comfortable to you when you are going to read. Understand this thing, because these standard books are not going to help you in your final year university exams, because end of the year you have to write theory from that easy book and your from class note whichever you have made from any of the faculty. So theory, practical you should be knowing, and clinical some of the procedure and some of the surgical video you can know for imaginations idea. And this is the important topic list I have mentioned for practical as well as theory. If you have any questions, type in the comment box. and you can join our WhatsApp group as well as Telegram group for all the important updates, regular quiz discussion, clinical case discussion, and we are regularly giving some of the important understanding about these subjects which how to follow. So thank you so much guys, keep watching. In the next video I am going to tell you how to read surgery step-by-step approach for surgery subjects. Keep learning and stay tuned. Subscribe and share with your friends. Thank you so much.